Most people think honey belongs in tea, not on a wound. But medical grade Manuka honey is actually one of the most powerful tools we have in wound care for controlling bacteria and managing drainage. And when it's combined with calcium alginate, it creates a dressing that can fight infection while absorbing significant exudate at the same time. But here's something many people don't realize. If the honey isn't actually touching the entire wound bed, you can lose most of the antimicrobial benefits. So in this guide, I'm going to walk you through how Medihoney alginate actually works, when it's the right dressing to use, and key application rules. So let's break it down. Medihoney alginate is an advanced wound and burn dressing that combines two powerful wound care technologies. It uses medical grade Manuka honey, known for its antimicrobial properties, together with calcium alginate, a high absorbent material derived from seaweed. This combination allows for dressings to control bacteria while effectively managing wound exudate, creating an environment that supports wound healing. Medihoney works for two main reasons. First, Manuka honey has a naturally low pH, typically between 3.2 and 4.5. This acidic environment helps inhibit bacterial growth. Secondly, honey creates high osmotic pressure. What this means is that it draws fluid out of bacteria and the wound environment, helping reduce bacteria burden while supporting the body's natural healing process. At the same time, the alginate component absorbs drainage, turning it into a soft gel that maintains a moist healing environment. Medihoney alginate comes in two different formats, allowing it to be used for different types of wounds. The sheet version is typically used for surface wounds, and the ribbon version is ideal for packing deeper wounds, usually cavities, tunnels, or undermining. Choosing the right format helps ensure the dressing fully contacts the wound bed, which is essential for the honey to work effectively. You want to use Medihoney alginate for wounds that have a local infection and that have a moderate to heavy amount of drainage. There are also some precautions that you need to keep in mind. Some patients may experience temporary stinging when the dressing is first applied. This happens because of the honey's natural low pH. This sensation is usually temporary, but if it continues, the dressing should be discontinued. Medihoney alginate should not be used on patients with a known allergy to honey or alginates, full thickness burns, or wounds with heavy active bleeding. Before applying the dressing, proper wound preparation is essential. First, cleansing the wound thoroughly with sterile saline or an appropriate wound cleanser. Next, gently dry the surrounding tissue, so the peri-wound. If needed, apply a skin barrier product to protect the peri-wound skin from excess moisture and prevent maceration. Proper preparation ensures the dressing can work effectively. Next, size the dressing to fit the wound. The dressing can be cut to match the wound dimensions. Place the dressing directly onto the wound bed, and if you're using the ribbon format for deeper wounds, pack it lightly into the cavity. Here is the most important rule. The honey must be in contact with the entire wound bed. As the dressing interacts with the wound moisture and body temperature, the honey becomes fluid and spreads across the wound surface, delivering its antimicrobial effect. Once the primary dressing is in place, it should be covered with an appropriate secondary dressing. This dressing helps secure the primary dressing, manage additional drainage, and maintain a moist environment. The type of secondary dressing should always be selected based on the amount of exudate coming from the wound. Dressings can remain in place for up to 7 days. However, dressing changes should be determined by the amount of wound exudate. In wounds with heavy exudate, the honey may become dilute more quickly, meaning the dressing should be changed sooner. The goal is to maintain an effective concentration of honey in the wound bed. When removing the dressing, gentle technique is important. Use forceps to carefully lift the dressing from the wound surface. If the dressing appears to stick to the wound, don't pull it. Instead, flush the wound with normal saline to help loosen it and avoid damaging fragile tissue. When Medihoney alginate is working effectively, you should begin to see a reduction in signs of local infection, usually within 2 weeks. You should also note improved control of wound drainage and healthier surrounding skin without signs of maceration. These changes indicate the wound environment is becoming more supportive of healing. Effective wound care is a collaborative process between clinicians, nurses, and caregivers. Understanding how advanced dressings like Medihoney alginate work and how to apply them correctly can make a significant difference in the healing outcome. If you like this video, don't forget to like and subscribe, as it is a free way to support my channel and make sure it reaches a wider audience. That's all for this video, guys, and I hope to catch you in my next one. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.